Yes, good evening, Mr. Chair and Commissioners. The first page that I handed to you was, it'll show kind of the trend and history of our cases. So we're going back to March 16th, where we had our first positive case, and now through June 15th, yesterday. So you can see, the number of cases and how they've increased in Clay County. And then the second column is those that are released from isolation or no longer needing isolation, no more cases. So as we go down, that of course would increase with the number of cases that we have tested. So you see the difference between the 506 and 455. We also have the deaths in there, and although every death is significant, we don't want to minimize deaths, and it's tough on family and others to have any death from COVID. We have a total of 36 as of yesterday in our county. So we've increased with those that had COVID and then succumbed to that virus. So it's 36, although the number is lower than in many other areas. It's, we still recognize that's a significant that's significant for friends and family.
It's nice to see this whole state. You see the state of Minnesota is going down quite a bit too.
Right, yes. And then you see the active cases. Now, as of yesterday, that's 15. So there's only 15 cases right now currently in Clay County that we're needing to do case investigation, and then contact tracing would include a number larger than that. That's 15 cases, but depending on how many contacts they have, we would follow up. But that's a pretty good number, pretty low number. So we've seen a bit of a decrease this week. So we'll look at the trends and watch to see how that's going. We hope it doesn't increase. We're still doing the point prevalence testing in the congregate care, long-term care, assisted livings. Minnesota Department of Health is working with the Minnesota National Guard in many of those cases and doing point prevalence testing. So just that day testing those residents and staff, and they'll do that with 3 series. So, and they are between 7 and 14 days apart for those testing. We also have the static testing sites in Fargo, and those are set up. They're the National Guard that's setting up those sites. I think I mentioned that last week. And we are able to assist those congregate care settings to get their staff tested over there. They make appointments. They take all of the staff from Clay County as well as the Fargo side, and they can be tested at those static sites per appointment. So that's working out quite well to get testing done right away. And then, of course, you saw in Fargo where they had the mass testing. They set that up last Thursday and Friday. I believe it's going to be set up again this week. And that is just for anyone in Minnesota and North Dakota. So people can go through that mass testing. There was 878 that were tested on Thursday and 903 on Friday. And so I think that went pretty well. There was no requirement. The testing at Sanford and Essentia, they need to meet some requirements as far as having symptoms or being exposed to someone that was positive. But this mass testing, anyone could go through. So
is that a free testing then, or you have to turn that into insurance?
Nope, that's free. I mean, someone's paying for it, but the customer doesn't have to. So, yeah.
Okay. Thank
you. Right, that doesn't go through insurance. They don't do the insurance process with those testing. And I believe the static testing doesn't go through the insurance either for those staff that can go over to those sites per appointment. The second page, I just wanted to show you that it lists a number of the states across the United States. You can see these are daily cases. And where Minnesota, we're trending down a little bit in daily cases versus 2 weeks ago. North Dakota's trending up just a tad, but it's not like a huge influx of numbers, but they're in the orange, as you can see. Minnesota's in the green, so we're trending down a bit. And then it shows the other states across the United States that are either trending up or down or staying about the same. The third page I have is new and total cases. Average new cases per day. So it shows the United States 3 weeks ago, 22,587. And then you can see 2 weeks ago it was 21,000. Last week it was 20,700. So you can see kind of the trends of average new cases per day. And then I thought it would be interesting to show Minnesota and North Dakota as well. So you can see Minnesota 3 weeks ago was 701. This is new cases per day again. And then they trended down a bit in Minnesota each of those weeks. North Dakota was up 3 weeks ago, went down 2 weeks ago, but then kind of is coming back up and going back down, so they're fluctuating a little bit.
Okay, just I'll go back to that page 2 again. Like Alaska and Hawaii and Vermont. Is that showing that their cases are going up?
Trending up.
They're trending up, huh?
And some of it may be, there might be some part of that that's increased testing, but some of them also just as, they're watching the states that are really opening up, and just to see
Could be lower
if we're seeing more
population.
cases after people are, less social distancing, maybe less use of the face mask. So that'll be interesting to watch as the cases, will they rise in some of those communities that are really opening up widespread? Seems to be a little bit true for Arizona. They opened up in May. They're seeing a trend up. They're not contributing that totally to testing, so they're thinking there may be some, again, more spread, community spread, lack of social distancing, maybe a little bit less adherence to wearing the cloth face mask. So I understand where people get a little tired of this and the social, being isolated. So it's easy to just want to go out and not have to worry about all that. But we have to watch that just because, COVID isn't gone away. We're going to be seeing it, potentially, as the experts say, ramp up in the fall. So we really need to be watching what the trends are doing.
I see they're coming up with some good ideas with these masks already, the turtleneck type thing or whatever it's called, or hoodie or whatever. Or some nice masks out there already.
Did you get one yet?
No, I haven't. No, my wife made me one and I could barely breathe through it, so I think there's an ulterior motive
did
there.
that on
Maybe she
purpose.
planned that.
Yeah, I think there's a very tight straps too, so
Do you want to maybe get one from us?
probably I'm looking for a new brand, yes.
No more comments on that.
Okay,
And then on the third and fourth page, it's really just showing our new cases still growing. So another little graph to show, New York is kind of has been always a problem. So the first page is showing New York in comparison to Minnesota as far as trending up. These are cases per 100,000 people. And then on the last page, we're showing North Dakota as well. So New York in comparison to North Dakota. So, I think generally speaking, we're doing pretty well. I wish we had no deaths from COVID, but for the most part, we're doing better than many across the United States. So any questions? I know I went through that quick because I know I have a deadline.
No.
In terms of watching numbers, how confident are you that we are prepared to deal with if there is a second wave in Clay County? Do we have the supplies and the manpower that we need to?
They will need to, they are working on getting, we have enough personal protective equipment right now that we can receive, and they will actually start replenishing those stocks. What I heard from someone at one of the healthcare facilities, Sanford or Sencha, they had nurses that were using one mask and one for every week, so they weren't even getting new masks. They are now finally, just last week, getting some extra masks, so they don't have to keep reusing masks. So that's good news that there's more PPE, personal protective equipment, cache. So they are certainly, MDH is working on, we're looking at how is this going to look. We're working with some of the colleges right now to look at how is that going to look when the students come back. And so MDH has some resources out there for the campuses, and I have a staff person working with those, the leadership of those colleges. So there's a lot of work to continue doing for a potential in the fall, and we're pretty confident there will be no vaccine. They keep saying they're trying to expedite it, but we're pretty confident we won't see that this fall based on some of the experts. We will have the flu vaccine, of course, but we're going to have the flu, of course, ramp in the fall too. So we'll have the influenza and we'll have COVID. So it's going to be an interesting mix there. Did I answer your question, Commissioner Marshall? Any
Okay.
other questions for me?
Any questions or further questions? No, thank you for the update.
Okay, you're welcome. Thank you.